Welcome to the deep dive. Today we are plunging into, well, a pretty complex stack of sources about a specific pet health issue.
We are indeed. We're focusing on those tricky internal parasites known as whipworms.
Right, trichuriasis in dogs and cats. We've got veterinary study guides, management protocols, lots to unpack.
Exactly. And our mission today is to really sift through all this, cut past the jargon, and give you the essential stuff.
What they are, how they affect pets, and crucially, how to spot them, treat them, and stop them from coming back.
Let's get right to it.
Okay, so first things first. What exactly are whipworms?
Fundamentally, they're intestinal parasites. They belong to the genus Trichuris.
And the name whipworm, does it describe them?
It really does. They have this distinctive shape, a very thin front end, like a whip slash, and then a much thicker back end.
Okay, whip-like. And where do they actually live inside the animal?
They prefer the lower part of the intestinal tract. So think cecum and colon, the large intestine.
And what do they do there? Just hang out?
Well, they use that thin front end, the lash, to sort of burrow or embed into the lining of the gut wall, the mucosa. That's how they feed and unfortunately cause irritation and damage.
Nasty. Is this mainly a dog thing or cats too?
It's predominantly a dog issue. The main species we worry about in dogs is Trichuris vulpis. It's common and can cause significant disease.
Any cats?
Cats can get whipworms, species like Trichuris campanula or serrata, but it's much rarer, especially here in North America, and usually if they do get infected, it's less severe than what we see in dogs.
Okay, so primarily dogs. Got it. Now the life cycle. I hear this is where whipworms get particularly, well, difficult.
Absolutely. Understanding this is key to why there's such a persistent problem. It's what we call a direct life cycle. Meaning no intermediate host is needed. It's just the dog or cat and the environment. But there's a twist, a really important one.
Okay, tell me about the twist.
It starts conventionally enough. Adult female worms living in the large intestine produce eggs. These eggs are microscopic.
What do they look like?
They're quite characteristic, sort of football-shaped with these little plugs at both ends. We call them bipolar plugs. These eggs get passed out in the pet's feces into the environment.
Right. Poop in the yard, eggs in the yard. Seems standard.
It does, but here's the catch. Those eggs aren't immediately infective when they land in the yard.
Oh, yeah.
No. They need time to develop or larvate in the environment. This usually takes somewhere between 9 and 21 days, assuming conditions are right. Warm, moist soil is ideal.
And once they've developed, then they're trouble.
Exactly. Once they contain that developed L1 larva, they become incredibly hardy, super resistant.
How hardy are we talking?
We're talking survival in soil for months. Some sources even say up to 5 years.
5 years? Seriously?
Seriously, that's the real nightmare for control. An area can remain contaminated for a very, very long time.
Wow. So how does a pet get infected then?
Infection happens when a susceptible animal, usually a dog, ingests these infective larvated eggs.
From eating dirt?
Yeah, typically from eating contaminated soil or maybe contaminated food or water, or even just grooming themselves if they've got contaminated soil caught in their fur.
Okay. So they swallow the egg, then what?
The egg hatches in the small intestine, releasing the larva. This larva then makes its way down to its preferred spot, the cecum and colon.
Back to the large intestine.
Right. And there, it embeds in the lining and matures into an adult worm, going through a few molts along the way.
And how long does that whole process take, from swallowing of the egg to having adult worms shedding new eggs?
This is the other big challenge, the pre-patent period. It's really long for whipworms.
How long?
In dogs, typically 70 to 90 days. That's roughly 11 to 12 weeks.
3 months. So a dog could be infected and have worms growing for almost 3 months before any eggs show up in its poop.
Precisely. And those worms could be causing inflammation and signs of illness during that whole time.
So you could have a sick dog, but the fecal test is negative.
Absolutely. It's a critical point for diagnosis and treatment. The signs can appear well before the worms are mature enough to reproduce. And just to clarify, the sources mentioned there's no migration outside the gut. It's all happening in that lower intestinal tract.
Okay, so incredibly tough eggs that last for years and a 3-month lag before new eggs appear. That definitely sounds challenging. Where do pets usually pick these up?
It really boils down to ingesting those contaminated eggs from the environment. Because the eggs last so long, reinfection is super common. A dog gets treated, feels better, goes back to the same yard.
And picks it right back up again.
Exactly. Any place where infected feces have been left and not cleaned up promptly, especially those moist, shady spots in a yard or kennel, can be a source for years.
Are they everywhere?
Pretty much worldwide, yeah. They tend to be more common in warmer, humid climates because the eggs develop better there.
Any age of dog.
Any age can get infected, sure. But clinically significant disease is often seen more in adult dogs, maybe compared to things like roundworms, which are classic puppy problems. And again, cats, really quite rare.
Okay, so knowing all that, what should someone look for? What are the signs of a whipworm infection?
It's a spectrum, really. Depends heavily on how many worms the animal has. A light infection, you might see no signs at all. Asymptomatic.
But heavier infections.
That's when the signs become more obvious, especially in dogs. And there's a classic one the sources really highlight.
Which is?
Chronic, large bowel diarrhea.
Large bowel diarrhea. How is that different?
Typically means more frequent defecation, maybe straining, often with mucus so it looks slimy, and sometimes, crucially, with fresh red blood. That's called hematochezia.
Blood in the stool. That sounds like a big warning sign.
It definitely is. That fresh blood comes from the damage the worms do embedding in the colon lining.
Okay, so chronic, maybe bloody, slimy diarrhea. What else?
Straining to defecate, that's called tenesmus, is common too because of the irritation. With chronic, heavy infections, you can definitely see weight loss over time. Maybe a poor hair coat, but that's not very specific.
Or anything more severe?
Yes. In really severe, long-standing cases, the chronic blood loss can lead to anemia, and the persistent diarrhea can cause dehydration.
Now, I remember reading something really unexpected about severe cases mimicking another disease entirely.
Yes. You're probably thinking of the pseudo-Addison's phenomenon. It's fascinating and clinically really important, though rare.
Pseudo-Addison's.
Yeah. In some dogs with very severe Trichuris vulpus infections, the blood work can show really dramatic electrolyte changes, specifically low sodium, hyponatremia, and high potassium, hyperkalemia.
And that looks like Addison's disease.
Exactly like Addison's disease, which is hypoadrenocorticism, a serious endocrine disorder.
How can a worm in the gut cause that?
The thinking is that the massive inflammation caused by a huge number of whipworms severely disrupts the colon's ability to regulate electrolytes and water absorption. It can also cause metabolic acidosis.
So it's not the adrenal glands failing like in real Addison's.
Correct. The adrenal glands are usually fine. It's the gut damage mimicking the electrolyte signs. It's a major diagnostic curveball. You'd need specific tests, like an ACTH stimulation test, to differentiate it from true Addison's.
Wow. That's a serious complication from a parasite.
It absolutely highlights the potential severity. Other, maybe less common signs can include things like vomiting, lethargy, maybe a decreased appetite.
In cats, they get it.
Mostly subclinical, remember. But if they do show signs, it would likely mirror the dog's chronic diarrhea, maybe weight loss.
And always remembering that long pre-patent period. Signs can show up way before eggs do.
Always keep that in mind, yes.
Which leads us right into diagnosis. If you can have a sick dog with no eggs in the stool for months, how on earth do you diagnose whipworms reliably?
Diagnosis is definitely one of the trickiest parts. The standard method, historically, is fecal flotation.
Looking for the eggs under a microscope?
Exactly. Looking for those characteristic, football-shaped, bipolar plugged eggs.
But we just established there might not be any eggs to find.
That's challenge number one, the long pre-patent period. No eggs for up to 3 months after infection starts.
Okay. What else makes it hard?
Challenge number two is intermittent shedding. Even adult female worms don't necessarily lay eggs constantly every single day, so you might just happen to collect a sample on a day they're not shedding much or at all.
So bad timing can mean a false negative.
Definitely. And there's a third issue. The eggs themselves are relatively heavy, dense, meaning simple, basic flotation methods might not work well. The eggs might not float easily to the top to be collected. You really need to use specific techniques.
Like what?
Using a flotation solution with a high specific gravity, something dense like sugar solution or zinc sulfate is important. And performing centrifugation, spinning the sample down, is really the gold standard to force those heavier eggs up. Standard passive floats often miss them.
So just sending off a regular fecal sample might not cut it for whipworms.
It frequently doesn't. That's why many vets, if they suspect whipworms, will recommend submitting multiple samples, maybe collected over 3 consecutive days, to increase the odds of catching egg shedding.
Is there anything better now? Newer technology.
Thankfully, yes. Fecal antigen testing has become a really valuable tool. ELISA or PCR tests.
Antigen testing. So it's not looking for the eggs themselves.
Correct. It's detecting specific whipworm proteins or antigens that are shed in the feces by the worms.
Ah, so it doesn't matter if they're laying eggs that day.
Exactly. That's the huge advantage. It's generally more sensitive than flotation. It can detect infection during the pre-patent period before eggs appear, and it isn't foiled by intermittent shedding.
It sounds much better.
It is. So if you have a dog with classic signs that chronic large bowel diarrhea, but the flotation tests keep coming back negative, an antigen test is definitely the next step.
Okay. And what about just treating anyway, if you strongly suspect it?
That's the concept of presumptive diagnosis, or a therapeutic trial. And yes, given all the diagnostic hurdles, it's a very common and often justifiable approach.
So rule out other obvious stuff. And if whipworms fit the picture, you treat for them even without definitive proof.
Pretty much. If the chronic large bowel diarrhea is there and other common causes seem unlikely, initiating whipworm treatment is reasonable. If the dog gets significantly better, that strongly suggests whipworms were indeed the problem.
Kind of working backwards.
In a way, yes. And blood work, as we mentioned, might show supportive clues like anemia or, rarely, those Addisonian-like electrolyte changes, which would increase suspicion. The ACTH stim test helps sort out the electrolyte issue if it arises.
Right. Okay, so we know they're tricky to find. Let's talk treatment. How do we get rid of them?
Treatment really needs two arms. One, deworming the pet to kill the worms inside.
And two,
Rigorous environmental control. Because if you don't address the eggs in the environment, reinfection is almost guaranteed.
rigorous because those eggs are so tough.
Exactly. Killing the worms in the dog is only half the battle.
Okay, let's start with the deworming. What drugs work?
Several good options. Fenbendazole, often sold as Panicur, is a common one. It's typically given orally for 3 days straight.
Just 3 days and done.
Ah, no, that's the catch. Because of that long pre-patent period and the constant risk of picking up new eggs, a single round of treatment is rarely enough. You need to repeat it.
Why repeat?
To kill worms that were larval stages during the first treatment and survived, or worms picked up from the environment shortly after the first treatment.
So how often do you repeat fenbendazole?
Common protocols suggest repeating the 3-day course at around 3 weeks after the first one and then again at 3 months. So treatment at day 0, week 3, and month 3. Some might even recommend monthly for 3 months.
That's quite involved. What about those monthly preventatives many dogs are on? For heartworm and other things.
Yes. This is often the preferred approach, especially for ongoing control in high-risk areas or for dogs that keep getting reinfected.
How so?
Many broad-spectrum monthly parasite preventatives contain ingredients that are highly effective against whipworms. Milbenisin oxime is a key one found in products like Interceptor, Sentinel trifexis. Moxidectin in products like Advantage Multi is another.
So using one of those monthly chews or topicals can actually treat and prevent whipworms.
If used consistently every month, yes. It provides continuous pressure against any newly acquired larvae and kills maturing worms. It's a very effective strategy for long-term management.
Are there other drugs too?
Sure, combinations like Drontal Plus containing Feventel, Praziquantel, and Parentel are also used for treatment. The main point is that killing the existing worms often requires repeated or continuous effort.
And you definitely treat presumptively if the signs fit, even with negative tests.
Absolutely. And alongside the dewormer, you have to manage the symptoms, fluids for dehydration, maybe iron, or even transfusions for severe anemia, correcting electrolytes if needed. Sometimes anti-inflammatories for a really badly inflamed colon.
Okay, that covers the pet. Now, the environment where those super eggs live for potentially years. How do you tackle that? You said rigorous.
It is the tougher part. As we've said, the eggs are incredibly resistant to environmental conditions and many disinfectants, especially outdoors.
So bleach isn't going to cut it in the yard.
Probably not effectively, no. The single most important thing, the absolute cornerstone of environmental control, is prompt and meticulous removal of all feces.
Scoop the poop, like, immediately.
As quickly and thoroughly as possible. Daily is essential. Get the feces out before the eggs inside have the 921 days they need to become infective. That breaks the cycle right there.
What about cleaning surfaces? Indoors.
Indoors, thorough cleaning helps. Non-porous surfaces can be disinfected, though the eggs are tough. Steam cleaning might be more effective than chemicals alone on carpets or upholstery, if practical.
And outdoors. The yard. Dog parks.
That's the real challenge. Sunlight and drying help kill eggs over time, but in those damp, shady spots, they'll persist. Completely disinfecting soil is practically impossible.
So you can't really sterilize a yard.
Not easily or reliably. In extreme cases, like a heavily contaminated kennel run with gravel, maybe replacing the substrate could be considered, but for a typical lawn, it's usually not feasible. Consistent, immediate poop scooping is your best defense outdoors.
Anything else for the environment or pet hygiene?
Maybe trying to improve drainage in perpetually wet areas of the yard could help a bit. And regular bathing, especially for dogs with longer coats, might help remove some eggs they could pick up on their fur before they ingest them.
It sounds like prevention is really intertwined with treatment and environmental cleanup. Any other key prevention tips?
The absolute best preventative measure, according to the sources, is consistent year-round use of one of those broad-spectrum monthly parasite preventatives that covers whipworms.
The ones with milbemycin or moxidectin?
Exactly, especially for any dog with outdoor access or living in an area where whipworms are known to be common. That's your #1 shield.
What else?
Regular fecal exams are still a good idea, maybe annually or semi-annually, even for dogs on preventatives, just to monitor. And it bears repeating. Prompt, thorough fecal removal everywhere the dog goes. Avoid known heavily contaminated areas if you can. And basic hygiene, washing hands after picking up waste or gardening.
If you do all the deworming, the environmental cleanup, what's the prognosis? Can pets fully recover?
Generally, yes. With appropriate and, importantly, consistent management, the prognosis for recovery from whipworm infection is good. The clinical signs usually resolve.
But the big if is consistency.
Absolutely. The biggest hurdle is reinfection. If the environmental contamination isn't managed, meaning if poop isn't picked up religiously or if those monthly preventatives aren't given consistently, the dog is very likely to get infected again.
And those really severe cases, the pseudoanisons ones?
Those can be life-threatening if they aren't recognized and managed aggressively with supportive care like IV fluids and electrolyte correction. But even those dogs can recover fully if they get prompt, appropriate treatment for both the worms and the complications.
Okay, one last really important question for pet owners. Are whipworms zoonotic? Can I get them from my dog or cat?
That's always a concern with parasites,
Yeah.
but the sources are quite clear on this one. Generally, no.
No risk.
The dog whipworm, Trichuris vulpus, and the cat species are considered very host-specific. They don't typically set up shop and cause infection in humans.
Oh, that's a relief.
It is. Humans have our own species of whipworm, Trichuris trichiura, but that's linked to human sanitation issues, not typically passed from pets. So the risk of getting whipworms from your dog or cat is considered minimal to negligible.
All right, that was a really thorough look at whipworms. Let's try and boil it down. What are the absolute key takeaways from this deep dive?
Okay, #1. Whipworms, or Trichuris, live in the large intestine, cecum, and colon. T. vulpus in dogs is common and important. Cat whipworms are rare.
#2, the life cycle is direct. But the big problems are those super hardy eggs lasting years in the soil and that really long pre-patent period, like 11, 12 weeks before new eggs are shed.
Yep. 3. The classic sign is chronic large bowel diarrhea, often intermittent, maybe slimy with mucus, maybe with fresh blood. And remember that rare but serious pseudoaddison's complication.
4. Diagnosis is tough due to intermittent shedding and that pre-patent period. Standard floats often miss them. Fecal antigen tests are much more sensitive, and treating based on suspicion is often necessary.
5. Treatment requires repeated deworming doses, or ideally consistent monthly preventatives containing things like milbemycin or moxidectin. You have to keep at it.
6. Environmental control is non-negotiable. Prompt daily fecal removal is the most critical step because the eggs are so persistent outdoors.
7. Prognosis is generally good if management is consistent, but reinfection is super common if environmental hygiene slips or preventatives aren't used reliably.
And finally, #8. Thankfully, not considered a significant zoonotic risk from pets to people.
I think that covers the core insights from the sources.
Perfect. Thanks for joining us on this deep dive into the world of whipworms. Hopefully you now feel equipped with the essential knowledge, from understanding their sneaky life cycle and why they're hard to diagnose, to knowing the effective treatment and, so importantly, prevention strategies. And as we finish up, here's something to think about, drawing from what we've discussed. Knowing just how incredibly tough and long-lasting those whipworm eggs are in the environment surviving for years potentially, does that change how you view shared outdoor spaces? Places like dog parks, trails, even common grassy areas where many pets go. It really makes you consider that invisible microscopic landscape our pets are navigating every single day. Something to mull over.